For me, one of my prior work experiences was I was a server or a bartender, you know? Like, you don't think that that's anything healthcare related, but that's actually some of the biggest qualities that interviewers look for is their customer service skill. So the way that I formulate my tell me about yourself, I said the name, the claim, the demonstrate, which is you demonstrating what you have done, and that's what you just said, and then differentiate. So what makes you stand out from other people that are applying to the same unit you are? Okay, tell me about a time when you had to advocate for a patient.
So I was doing clinical at a long-term rehab facility.
Okay.
He had drier skin, and the lotion that was provided by the long-term care facility was really thin. It was really watery, and so his skin was continuing to flake.
Mm-hmm.
And so his wife had actually brought in some aquifer, which is like a lot thicker. The nurse just kept using the really thin one, and no slight to that nurse. Since I was the student and I, that was something that I could do on my own without the supervision of my nurse. I ended up going back around and kind of rubbing him down with the aquifer that his wife brought. And you could just tell, night and day was a lot better for his skin.
Totally. Love that story. The only thing I would say is to add an ending to it. Something like, since I went the extra mile for this patient, it turned their care around. Their skin was so much better. They were happier in their care. I was really able to focus on the patient's needs when everybody else was so busy focusing on other people. So it makes you look like you went the extra mile, you really wanted to help the patient and really listen to what they were complaining about without even them asking. So that's a good one. I like it. Just add the wrap up at the end. Describe a mistake you made on the job or in clinicals and how you handled it.
Okay, this actually just happened. So we had clinical on Monday, and we are currently doing our critical care rotations. And this was the very first time that I had done a tube feed.
Okay.
And so, I had the mixture and I was mixing the Metamucil because we were about to put it through the tube feed. And it's thick.
Yep.
So I connect it and I'm pushing it. And I'm like, okay, it's thick, but I'm like really pushing it and it wasn't going. And so I kept trying and it was like, and it just like
sprayed everywhere.
Everywhere, yes. And so I was like, She was like, no worries. She was like, flip the turncock and like, we'll get another towel. And so just kind of like following her direction, but just knowing that I had somebody right there that was like, you're okay. I think it just immediately kind of brought my nerves down and it allowed me to kind of follow the rest of her directions so that we could continue to deliver the tube feed for the patient.
That's perfect. I love the way that you explained that too. That whole story was great. Now don't push that that thick medication. If it's not gonna go, it's gonna spray in your face. And you can even make lighthearted like a joke about that too. It's like, now I know for later, like, I will never push that medication that hard or something like that. So This one is specifically for pediatrics because I know that's what you're interested in. How do you make sure that parents stay calm and help in your work instead of hindering your progress?
I think for me, just making sure to talk to them in a calm voice. I think if somebody is already panicked and you seem panicked either in your face or your demeanor or you're kind of moving kind of erratically or just in your speech, I think that just kind of elevates that panic in a parent, but also keeping the parent informed as you continue to go on, because then that kind of eliminates the parent of being like, wait, so what's happening? Okay, so wait, what does that mean? Okay, wait, so what's going on? Being reactive, like we want to be proactive so that we're not having them hinder the care because we're being proactive and kind of talking out loud and letting them know what's happening.
Love it. That was the perfect answer. Communication, being proactive instead of reactive is huge. Sometimes the hardest part is the parents, not the patient. What qualities do you possess that will benefit you in this hospital or this unit?
I like to consider myself a chameleon. I feel like I am able to kind of fit with lots of different people, and I can kind of figure out how I need to communicate with that person, how I need to interact with that person. I'm very energized by people. Since I want to work with pediatrics, I think that that's a good quality when it comes to kids, because hospitals can be really scary places. So to have someone that comes in and they're, excited to see you, and not saying that like I'm excited and I'm happy that you're in the ER, obviously, but, doing what I can do to make this scary experience the best scary experience that you've ever had.
I love that. Yeah.
I think that I have experience working with a lot of different cultures, and I think that experience really allows me to deliver culturally competent care.
Ooh. Okay. Love that. Okay. Keep going.
Especially to patients and families that have cultures that are different than my own. So yeah, I'll just keep it.
So you were culturally competent. You bring energy to the unit. You are a huge people person. I love the culturally competent explanation, but you can even cut it down to just be more of like a punch of like, I have worked with many populations that has made me culturally competent, and now I know how to deliver care to many different types of people and different populations, and that will really benefit me as a pediatric nurse. Yeah, I loved it. That was so good. What about your weaknesses? Have you looked into what you would say for that?
Yes. I would definitely say that a weakness of mine is just internally beating myself up if I don't get something right the first time.
Okay, you're hard on yourself.
Yes.
Okay.
And so even so far in clinicals, I've attempted 2 IVs and have not been successful on either of those. A lot of it was because I was comparing myself to my classmates, and I'm definitely working on not allowing, myself to get down to where it affects the care that I deliver to somebody else.
That's a good weakness, because I feel like everybody struggles with that. We all are hard on ourselves if we, especially as a new grad, we're hard on ourselves if we don't get the IVs or if we don't catch a symptom. Or only thing now is to turn it into a positive, right? Because we always, with our weaknesses, we don't want to shit on ourselves, but we want to turn it into a positive at the end. I would keep the "you are hard on yourself" brief. Just, I am hard on myself, especially as a new grad. I've had experiences not getting an IV the first time, and that was hard for me, but I'm learning to not take it so personally and not take it into a patient's room and allow myself the grace to make mistakes or not get things right the first time or something like that. So it turns into a positive. As we all know, new grads are always going to be hard on themselves. So you can say that too. Like you can say, I know that as a new grad, this is going to be something that I struggle with, but I'm excited to gain the confidence or work on that as I go along.
Could I say, I feel like because I'm hard on myself, that it makes me want to keep trying.
Absolutely. Although I am hard on myself when I don't do something right or I don't catch a sign and symptom, etc., it's something that I challenge myself to do better the next time or revisit that topic, in studies after work so that it doesn't happen again, type of thing. Which just shows that you are passionate, that you are working really hard and you want to do things right and get things right. And yeah, while you lay in bed, think of clinical scenarios that you've had in school and how you could incorporate those into questions. So whether it be how you advocated, how you went above and beyond, different, how you've handled a patient of a different culture, how you've handled a patient or a family member that didn't agree with what you wanted to do, or, scenarios that you can kind of keep in your pocket and throw into any of these questions. Tell me about yourself. You have a great one. Just incorporate something about your work history that really stood out to me. I really liked that. That was great. You did good. Yeah.
I'm a little nervous.
Oh, that's okay. That's okay, because we're all going to be so nervous,
Thank you.
Yeah, good luck.